I want to thank you for joining us at the 11 Alert Desk today. I'm digital content producer Aspen Andrews, and I'm here with Steve Carleton, Chief Clinical Officer at Porch Health. And Fentanyl Prevention Awareness Day is on August 21st, and at the end of this month on August 31st is Overdose Awareness Day. So we just wanted to hop on a little bit to discuss some of these topics with you. And first off, Steve, what exactly is happening with the overdose rates in Colorado?
A few things are happening simultaneously with overdose deaths. The first one, and the one to be celebrated, is nationally and in Colorado, we did see a decrease in overdose deaths, and fentanyl-specific deaths dropped a little over 20%. However, in Denver specifically, just in the first 6 months of 2025, there's been about a 20% increase within Denver city limits. So we're seeing kind of this one pocket where there's an increase. But overall, nationally and in Colorado, we're making progress, which is good.
And how specifically have we seen a change when it comes to fentanyl?
Fentanyl, it's really interesting. I mean, what we're seeing now is fentanyl being mixed with sedatives, and that's been the trend lately. That's been the most dangerous and the one of biggest concern.
And you've kind of touched on it a little bit, but how exactly has the fentanyl crisis evolved?
Again, like going all the way back, it evolved from prescription opiates, OxyContin being overprescribed, pharmaceuticals really turning off the faucet of making those drugs available. People turned to heroin and now fentanyl. And now we're seeing this fourth wave of fentanyl plus sedatives. And just really the trend is people are using multiple types of substances at once. They're using painkillers or opiates. They're using stimulants like method cocaine, and they're using sedatives like Xanax and Valium and other things. But on the street, those sedatives are xylazine and these other type of really potent sedatives that are just really dangerous, and they don't respond to Narcan is the biggest problem.
And how exactly can just the average person help when it comes to this epidemic?
Yeah, great question. So when we think about this, and Narcan is the medication that you spray in people's nose that reduces the effects of a fatal overdose. Right. So getting more Narcan in people's hands will certainly help continue to decrease fentanyl specific overdoses. The problem with Narcan is that it won't work if it is mixed with xylazine or these other different types of sedatives that are being cut into the supply. And so just that education, like helping people understand, like really and truly, like one pill can kill. If you're buying counterfeit pills, you really just have no idea what you're buying. That supply is just all over the place, and you really don't know what you're ingesting when you do that.
And what advice do you have for someone who might need help?
I think the advice for somebody out there that's struggling with addiction is that help is available, especially with opioids, right? Medication for addiction treatment has really turned it on its head. Like these medications are not addictive, right? They are physiologically dependent. Your body is there's no way around that. But in terms of that loss of control in your life, in terms of the consequences that people see when they're using street drugs, you don't have that when you're taking medication for addiction treatment, period, right? And so looking for opportunities and avenues to help yourself that way is just a really good idea.
And for those family members and friends, how exactly could they approach this type of subject with someone who might need help?
It's all about just leading with compassion, sort of understanding that nobody sets out to become addicted to drugs and alcohol, right? And typically using substances is a symptom of something else going on in a person's life. They're masking emotions or some other really difficult circumstance or experience they've had. So having compassion for that. And I think if you're a loved one or a family member trying to help out there, help them find options too, right? Don't show up empty-handed with like, you need help, right? Where do I go for help? Helping them sort of do some of that homework, do some of that research so they know where to go.
And while we're discussing, is there anything else you would like to add about the topic of fentanyl and overdoses?
No, I just think it's always needs to be said that Narcan or naloxone kits, there's standing prescriptions. You can go to any Walgreens and buy this medication from a pharmacy. Um, People don't use Narcan or naloxone on themselves, right? So if you're somebody that socializes, you're somebody that goes to parties, or you have kids or people that go to parties, putting Narcan and naloxone in the hands of people that do not use, those are the ones that are going to save lives. So the more we can have that out there, the more we can stay ahead of some of these really sad trends.
And where can people go to find some more information or to find help if they may need it?
Yeah, absolutely. So porchlighthealth.com is a great place to go and find some different information and resources. SAMHSA is another great resource. If you're looking for just more information on trends and whatnot, CDC has a lot of good data out there about what's going on specifically in Colorado.
Great. Well, thank you so much for coming to talk to us a little bit more about fentanyl and overdose awareness.
Yeah, my pleasure.